The title of my presentation is Effectiveness of Teaching Alternate Behaviors to Replace Tantrum Behavior Across Settings. This was a single case research project which was done to promote using replacement behavior such as requesting help across 3 settings, also promoting generalization. The question was, will teaching the replacement behavior of asking for help reduce tantrums across settings? The 3 different settings in this case were the classroom, a general education setting across different subjects, the playground at school, outside, different setting, and then at home during therapy time. The client is a 7-year-old male with OCD and also has tantrum behaviors still in all 3 settings. The social validity is valid because we want the tantrum behavior to reduce so that it can be replaced with a behavior such as asking for help or a more appropriate way than just having a meltdown tantrum. Replacement behavior research are limited across settings. However, replacement behavior studies are a common practice in groups of people, but they often have a lot of variability. The method that I chose was multiple baselines across settings, and the 3 settings again were the classroom, playground, and at home. The independent variable, which is the intervention, was requesting help. To do the intervention, we use cue cards, place them out that help the student to remember it's okay to ask for help instead of getting frustrated and displaying the tantrum behavior. To encourage this during an intervention, we used reinforcement such as positive praise, good job, way to go, I love the way you asked for help, things like that, and overexcited those. And then also sometimes we use an edible on days that we were really struggling and the positive praise just wasn't enough. We really wanted to exaggerate that praise, such as an M&M or a Skittle. The dependent variable was tantrum behavior. We recorded tantrum behavior in a frequency count during sessions for both baseline and intervention. We also recorded, just for our own findings, even though it was not the focus of this research design, the frequency of how many times the child asked for help. You can see from our results that it's obvious that when we were in intervention in each of the different settings, that we did see a decrease in tantrum behaviors, and really saw that in the last few sessions for all settings, avoiding spikes in general there. However, we would say that we're not sure that it generalized, because when baseline was over in the classroom and we had started intervention, we did not see a decrease in baseline in tantrums in the classroom or, in the playground or at home during therapy. So while we had started intervention one place, it didn't seem like it carried over to the next place. So those are kind of the findings of this study. Some things that we would change in the future would be time. It seemed as if time was a huge constraint because we had to visit multiple settings within the same day to get all the sessions in. So if the child was just having an off day or something along those lines, then maybe there were more tantrums that day. Or if he was having an exceptional day, maybe we saw less tantrums that day. Overall, we would say that the intervention did work and it was effective in reducing tantrum behavior across all 3 settings.